Coming up next, CityNet 30 takes you downtown for the weekly luncheon meeting of the City Club of Portland. Live weekly coverage of City Club is made possible in part by TCI and is produced through the facilities of Portland Cable Access. Now we join the City Club for this week's program.
Good afternoon and welcome to the City Club. I'm Pete Heuser, your president. Today we're going to hear from Dr. Jane Knitzer from Columbia University, who will share her perspectives on early childhood development. Our program today is sponsored by Washington Mutual Savings Bank, the law firm of Miller, Nash, Weiner, Hager, and Carlson, and Kaiser Permanente. We're very grateful for their support. Now, as you know, each of the past few weeks we've been having representatives of our issue committees come and talk to us about the things their committees have been doing this year. Today we're going to hear from Louis Simpson, who is co-chair of the Healthcare Issue Committee. Louis has been a long-time member of the club, and we're grateful to have him among our leaders. Louis?
Thank you very much, Mr. President. Good afternoon, everyone. It's always great to look out and see so many beautiful people. And so would like to say one thing. It's a great way to start the day. 7:30 every first Thursday, that's the time we meet. And you of the City Club are certainly welcome to be there, any member. On the other hand, we want to get some members. We want some people to join with us. We are now looking at presenting a speaker to the program committee who will speak on complementary care. Complementary care is certainly coming to life now. It used to be alternative care, but complementary care is going in the mainstream, and this speaker would speak to us about what's happening in the year 2000, not by any Y2K. We also have a speaker we're going to present from the Food and Drug Administration, and this particular speaker will bring us telling us about the safety of our food and also the factor of the safety of our drug supply. Now, they're not as overall as much in the drug supply, but if you've noticed the news lately, as far as not only prescription drugs, but other drugs, they have larger things where you can read what's there, no small print. And we're also looking at children's health. This will be a big factor. And here in Oregon, it's a crisis just almost as large as that we have in education. So it's a pleasure to have all of you today, and thank you, Mr. President.
Thank you, Louis. You may recall last fall we had a presentation by Medea Benjamin, who talked to us about working conditions in some Asian manufacturing plants. Now, next Friday, a week from today, here at the Multnomah Club, you'll want to join us as Maria Eitel of Nike. We'll talk about Nike's programs for its overseas manufacturing facilities and some of the things that Nike's done in the last year to try to correct the problems that we're all aware of. Again, that'll be here at the Multnomah Club. I want to make sure everyone sees the notices in this week's bulletin about two special member series that we have, and this is for members only. The first is a 4-breakfast series featuring state legislators who are going to talk on important topics in this legislative session. The second is really exciting. It's a 4-part after-work series featuring presentations and hors d'oeuvres by 4 of Portland's famous chefs. So you'll want to make your reservations soon for both of those, because space is very limited and they're filling up fast. Next Wednesday, March 17, the Public Services and Safety Issue Committee is sponsoring the first of its series of 4 meetings with homeless youth service providers. That's at noon next Wednesday, March 17th at the club office. If you're interested in attending or want more information about that, please call the club office. Now, our host seated at the table today is Pauline Anderson. Pauline is past president of the City Club and a retired member of the Multnomah County Council. She'll be introducing Dr. Knitzer, who I understand is staying with her this week, and ask the first question today. And then after her question, we'll take questions from the audience, from City Club members only. Please try to keep your question to 30 seconds. Thank you very much. Pauline Anderson.
Thanks, Pete. Yesterday, I had the privilege of introducing Dr. Jane Knitzer to enthusiastic, hardworking early childhood experts at Lloyd's Cinemas, where she inspired them with wisdom and common sense and a bit of popcorn. Today, never one to waste perfectly good material, I asked for the privilege of introducing Dr. Knitzer again to the members and friends of City Club, and I'm delighted to do it again. City Club is on the leading edge today because early childhood is in. The city's into it, the county's into it, business is into it, the United Way is into it, even the Oregon Community Foundation is into it. Enlightened self-interest, if you will, because we all know now that the health and wealth of our community and its citizens are largely determined in the womb, in the cradle, in the nursery. Society, with the help of contemporary brain research, has discovered that adolescence is too late to learn empathy and caring, nonviolent approaches to life, and to develop the ability to learn. Middle school is too late. Elementary school is too late. Kindergarten is on the edge. For empathy and caring and nonviolence and ability to learn, you gotta come in at the door. And that door is 0 to 3. The Early Childhood Care and Education Council, affectionately known as ECK, has brought Dr. Jane Knitzer, the K is silent as in knowledgeable, from far off to inspire us to strike while the iron is hot, or more contemporarily, while we have this window of public interest. Dr. Knitzer is currently Deputy Director of the National Center for Children in Poverty at the Columbia School of Public Health in New York City. When I was handed 10 pages of her outstanding works and credentials, I said, come on, I'm not going to say all that. Suffice it to say that she has been a director, a dean, a principal investigator, a fellow, an adjunct professor, a consultant, a research associate, and an advisor. She has been awarded grants, and she has been granted awards for outstanding service in the field of children's mental health. And she has published. Her most recent titles range from Integrated Services for Children and Families, to Children from 0 to 6 in Urban America, to Children, Families, and Government, to Children and Welfare Reform, to Early Childhood Mental Health Services, a Policy and Systems Development Perspective. In the latter publication, she decries the fact that the system is not a family-centered system, but a child-centered system, where the child is the client. She tells about one clinic where the baby was named the indicated client. The comptroller was concerned, as comptrollers are wont to be, because the baby could not sign the treatment plan. Jane, who proposed a thumbprint, didn't even get a chuckle. Dr. Knitzer has all the proper credentials, a BA, an MEd, an ED, and an NIMH postdoctoral. But for all that, Jane knows kids, and that's what she's going to talk about with us today. Welcome, Jane Knitzer.
Thank you for the second time round, the really gracious introduction. I am very delighted to be here. I've had a real wonderful sampling of Portland in a day and a half. I've had sun and rain. I'm staying on the Andersons' wonderful houseboat. I've ridden on your Max. So I feel like I'm almost a transplanted New Yorker. You know, in a funny way, Pauline said everything that I need to say to you. So I hope you really listened hard, not to the stuff about me, but to the way she framed the introduction. Adolescence is too late. Elementary school is too late. I hate to use the words too late, but I will for rhetorical flourish. Preschool is borderline, and for most young children, particularly those who are growing up in overburdened families, distressed families, we need to get in at the front door. So let me talk to you about what the research says, give you a sense of a national scorecard on how we're doing with young children and families, and then I want to end with a challenge to all of you, which is pretty presumptuous of me, but I'm getting on the plane tonight, so it's okay. Much of what I say is based on the work that we do at the National Center for Children in Poverty, and we are a unique national organization in that we focus on young children from 0 to 6, with a mission to identify and promote poverties that reduce to identify and promote strategies to reduce poverty and to help families who are raising young children in poverty. So much of what I say is based on the work that we do. Why should we pay special attention to young children? You know, the old line, and I'm going to sound really quite sexist in saying this, especially for many men, was anybody can raise children. Anybody can do it. And we actually pay people who raise children, child care workers, etc., as if anybody can do it. But a funny thing is happening. We are learning that the most opportune moment for learning for young children is from birth to 3. We have an institutional system that starts at best at 6. We have a disconnect between what research is telling us, and to some extent what research is telling us, you understand, is probably what most grandmothers knew, right? How you nurture and care for a young child sets the stage. But now we can say it in fancy words and we can show it. I don't know how many of you have seen the PET scans of the brain development and the synapses growing on television, and it's really quite scientific and it's quite remarkable. And what we've really learned is that early learning is not so much about learning colors and shapes and all those wonderful things that Fisher-Price toys do, but early learning is really about relationships. Can you trust the world? Can you not be impulsive? Can you not expect that anybody's going to hit you? This really has a lot of implications for entering school. We really have a national crisis in this country. We're hearing from kindergarten teachers all over the country that somewhere between 30 and 40% of the children are entering school, quote, not ready to learn. Now, they don't always mean that the kids don't know their colors. They mean that the kids are out of emotional control and they're not emotionally available to learn. And that's the kind of learning that happens in the earliest years. So that's the kind of learning that we really need to pay attention to. And I suspect now, with all the emphasis on early brain development, most of you know that by the time a baby is 3, 90% of the brain size is developed. But lots of the connections are also developed or not developed. And you can actually see the difference in the brains of children who have been deprived or not deprived. So we need to really think differently about the infant and toddler years. The funny thing is happening across the country. Particularly in our welfare policies, we're ignoring that. One of the things that's happening is we're saying to moms the most important thing you can do is not to learn about parent-child development, but go to work. I'm not saying that's not important, but it's a balance. And if we squeeze out for parents who themselves may have had a very hard time and not been well parented, any opportunities for learning how to build different kinds of relationships with their children, we hurt ourselves. And I know that you have heard the author of that wonderful book, Ghosts from the Nursery. You truly have a gift in Oregon. That is, I think, an absolutely wonderful book. I think we should actually send it immediately, perhaps with an abstract, to Congress. It's a very compelling book, and I think she says what we need to pay some very hard, serious attention to. Second reason to pay attention to early care and child development is that we know from a host of other studies that young children need a formal, comprehensive, educationally rich kind of experience, that children who have that hit the schools better. Your own data in Oregon tells us that you have a school readiness benchmark, and your own data from the state tells us that 62% of the children who have been in preschool programs meet all the benchmark requirements of school readiness. 50% who have not had 50%, half, who have not had any preschool experience, do not meet the school readiness criterion. Why is that important? Again, we don't have enough quality comprehensive child care for everybody. And what's happening is the poor children, who are the most likely to be not included in preschool programs, are being cared for in informal caregivers with relatives. Now that's fine, and many of you may have preferred that kind of care for your own children, but you probably also included some formal preschool program. It's not clear that under some of the welfare reform legislation, families can continue to do that. So we need to pay attention to that. The third reason to invest in young children is that we have a choice. We pay now or we pay later. We pay up front for intensive intervention for some of these children, or they become the seriously emotionally disturbed children of the future who are going to cost the child welfare system, the juvenile justice system, and the mental health system. And we know that. We can track that. You have interesting problems here. These are invisible problems in Multnomah County. You have children being kicked out of child care centers all over the county, and there is no formal system response for them. I did a poll yesterday, right, with this group of child care people, and I said, when I talk around the country and I say kids are being kicked out of child care, does it happen here? It was a pretty resounding yes. Those of you who were here, I think, yesterday heard that. We have a lot of children who have been damaged already. We need to pay attention to the cost. What's happening nationally? Well, states are beginning to get it. We do a report called Map and Track, Early Childhood Policies, and we track individual states every year. Every 2 years. Oregon looks pretty good. 24 states are funding comprehensive infant and toddler development programs. 34 states are funding preschool programs. 26 states are funding family support programs. States like you are paying attention to outcomes, sort of. We don't have very good outcome measures yet. We have identified about 8 states. Oregon is not one of them. That has really sustained consistent early childhood leadership. But Oregon comes pretty close. But then a funny thing is happening. As we get to the community level, we see very different kinds of patterns in all the states. Let me talk about first, before I do that, the issues that the Map and Track, our national data, raise. And we work with the National Governors Association to do this, and the National Conference of State Legislators, et cetera. One is that we have a real problem. We don't recognize any kind of child care as a human capital investment strategy. It is a low-wage, marginal industry. We have extremely high turnover in the child care world when young children need stability. It is very disconcerting for young children when their caregivers leave. We also have relatively untrained child care staff. We have major questions, as I just said, about what welfare reform will do to families with young children. We think that, it's all fine that the caseloads are dropping, but the truth is we don't know what that really means. It looks like some families are doing well, and they are, in fact, at least getting jobs, even if they're not getting out of poverty. They need information about benefits, more about that later. But there are also some families who are not doing so well. And we don't know what's happening to those families. And I think you probably have some of them in Oregon. What we're saying is, when you assess the impact of your welfare reform, look at the impact on child well-being. Child well-being, and this is research-based, although it sounds like grandma's common sense, child well-being is dependent. Family income increases, children will do better. If it decreases, they're not likely to. Children will do better if parental stress is reduced, because we know that parental stress leads to harsh parenting, more child abuse, etc. Children will do better if they have access to basic and support services. And one of the major concerns about the implementation of welfare reform, and I understand, at least I understood yesterday, not so much in Oregon, although hearing that you have as much of a health crisis for children, a crisis for children in healthcare as you do in education, I'm not sure this is right. But we're hearing across the country that one of the unanticipated consequences of welfare reform is that children are dropping off Medicaid. It is unconscionable that this society not cover every child for health care. It's, of course, unconscionable they don't cover every person, but, and I know you in Oregon have been out front. So access to support services becomes really very important, and if there's a disconnect between welfare changes and access to support services like Head Start, parents are telling us we can't put our child in Head Start because we have to work and Head Start's only half day. We have to figure out how to solve those problems. Third question I already started to talk about is what's happening at the community level. It is, after all, at the community level that real children and families live. How do we deal with this? Mother who takes 3 buses to get to her job, who relies on her neighbors for crisis child care. When it breaks down, she can't get to the job, she gets sanctioned. Mother who has a child with a disability. This is happening here. I know it's happening here. And the caseworker says, it doesn't matter that your child as a toddler is taking 15 pills a day. It's okay, and that you have to have a nebulizer whenever you go out. You can still work. That shouldn't impede your efforts. I'm sure you can find childcare. You all need to take a hard look at how welfare reform is really hitting real families and what it means to them. These are tough issues. Some of these issues have been with us for a long time. But I think the new piece of information is how can we nurture relationships? Not in people like you, although some people like you certainly need help with parenting. I did. It's not easy. But particularly families who have no resources and who themselves have not had nurturing parents. We need to pay attention to that part of work and family life in a new way, because if we don't, we will not have children entering school ready to learn. And that's the connection that I think we haven't made so clearly before. This really does relate to school reform. It really does. This is the start of school reform. It's not competency exams in the 3rd grade. This is the start of school reform. So, what does all of this mean? It means across the country people are recognizing that early childhood and early child development is everybody's business. And we are finding, for example, the business community beginning to get involved in new ways. And I'll just give you a few examples. In Colorado, the business community, a bank president, is actually leading a campaign for Educare, for quality improvement of child care and educational programs around the state, and is really going around and spending a great deal of time doing this. In Florida, a group of employers are pooling funds for extra subsidies for families who are not eligible for public subsidies, but who really can't make it because the subsidy cutoff is so low. We are finding business people who are reaching out and trying to understand what it takes to help first-time employees transitioning from welfare to work maintain their jobs and balance their family obligations. So, what does all this mean for you? As I said, I'm presumptuous. I'm going to get on the plane. But let me throw this out, and then you can tell me what makes sense, what doesn't, and you may in fact have better ideas. And I hope that your issues group on early care and education will really stay with this and join with the other activities that are going on in this community. And I actually will take a minute to mention it because I don't know that you did. Did you? There is a 3-stage process going on here, and I actually found it very impressive. That's one of the reasons I came here. You have a vibrant set of early care and education passionately committed leaders here. And they brought, me in as the traveling whatever expert here, not in New York. But they're doing more. They are developing what they call a second stage, which is to do a search process. Now, I'm not an expert on this, but it's some kind of structured procedure for developing priorities and engaging everybody in the community in it. And that's very impressive. And then there's going to be a smaller group who are going to follow up and make this happen. So there are many ways in which all of you can put your 2 cents in, or maybe your 200 cents in, and I don't mean just money. You bring a kind of expertise and perspective to this table, this early care and education table that we have all lacked. And I think it would be wonderful for all of you to engage. So what can you do? Educate yourselves and also ask tough questions of Multnomah County and of Portland. Find out what's really happening to the young children. What about the immigrant children in this community? Are they getting any access to the services they need? How many children in the more deprived areas do not have access to health care? What about to early childhood experiences, to Head Start or pre-K? Do some hard looking at those questions. How many children are being kicked out? Why aren't homeless children getting access to developmental support services? What needs to happen to make that work? Use your influence. Use your considerable influence to help the early childhood community create a kind of infrastructure to support early childhood. This is not a fly-by-night effort, but we have a disadvantage. No matter how bad the schools are, we love to hit them, right? But there are schools, and you can focus attention on the schools. The early childhood community is not so neat. There's no one place. It's the schools, it's family child care providers, it's home visitors. It's a fragmented system. We need your expertise. You people, probably some of you, run or are involved in global networks. Well, we need an early childhood network of new kind of power. Work actively with the early care and education leaders, and I hope that some of you will indeed join this search process. And I would also challenge you to develop a plan to work with local employers if you haven't done it. Have a summit. Find out what your own workers are experiencing with respect to child care needs. What do they need? Now, maybe you've already done this. You have a wonderful child care resource and referral agency here. Work with them. Find out what your new workers need. I'll tell you something. My kids are 21, but work and family life balancing under the best of circumstances was at times hellish. And I don't think we can forget that. And I'm somebody who had enormous flexibility. So think about that for the low-wage workers in this community. So hold a summit. Colorado would be glad to show you how they've done it. They've done it in every county. Work to increase local investment in prevention and early intervention. I saw one figure that said Portland was investing 1% and Multnomah County 7% in early childhood. How does that compare to what you're, quote, investing in deep-end kids? Child welfare, juvenile justice, mental health. Is that smart? Use your financial savvy to create, working with the early childhood community, some kind of a strategic plan to get us out of this crisis program by program box, because we're not going to get the kids doing what they need to be doing unless we do it. In my 2 days here, I've seen a vital community with energetic leadership, but I think that your voice is needed, and so I hope you will add it to the champions of young children. Thanks very much.
Jane, you have said that Multnomah County and Portland have wonderful plans, and on paper we look wonderful. As a matter of fact, I remember going places where they said, "Oh, you're from Multnomah County. You do wonderful things there." It's great, and we do wonderful planning. I never saw any group of people plan as well as Multnomah County people do. During this window of opportunity that we have, if you were queen in Multnomah County and could put some of these action plans to, or these plans to work, what kind of action would you seek and expect to have some results from? In a word or two.
One of the things I've already learned about Pauline is she is very incisive and direct, and I love it. I was very struck yesterday by the level of concern about the emotional development of young children in the audience, and by the level of need in those who are caring for them and the need for support. And I know that you have a beginning and very exciting early childhood consultation model. I think you need to draw in teams, community teams. It is unconscionable that a child be kicked out of childcare without some support to the family. That would be my first priority, because I see beginnings there, but I think, and probably you need a little more needs assessment, but yesterday it was pretty clear that this was what the audience was telling us. The second thing I would do is worry very hard about the group of families who are in low-wage jobs, who may not need a whole lot of help with relationship building, may not have domestic violence problems, but need to know every benefit that they can have to make it with the wages that they're earning. And so I would challenge you to work with the early childhood community and all the public agencies to put together an information packet and make it easily available to families to know what they can get. The Earned Income Tax Credit is the most powerful tool in helping low-income families make it. And I am very concerned. Nobody's been able to tell me how many families in Multnomah County are actually using it, how many they think could be using it. People do not know about child care subsidies. I don't know about Multnomah County specifically on that, but I will tell you all across the country there is massive confusion about welfare regulations, because they're very state by state and they're even local community by local community. Massive confusion about the new child health laws. Limited outreach effort to tell everybody about what kind of child care subsidies they're entitled to. So go for it. There are some people who've tried to do this, working with employers. Employers benefit from this. If they know what benefits, they're more likely to have a stable, low-wage workforce. So I would hope that you would do that. Is that enough for starts? Sure. Okay.
Hi, I'm Jane Cease, a City Club member. You mentioned some things that members of the business community are doing about improvements to help this situation. I'd be interested to know what kinds of things employers of new parents or just parents are doing or can do to be supportive or to get information to people about support services. And it's been a long time since I had a young child, so I don't know what's out there now, but it just seems to me that that's a logical place to make some connections.
You know, I think that's a very good question. In a number of places, the business community is contracting with the child care R&Rs to provide this kind of information to new employers. I think that one thing that makes a huge difference, all the data on work and family life suggest that the key, just as is true with welfare reform, the key to a family-friendly workplace is the supervisor. So I would start with training for the supervisor and let them understand, particularly low-wage workers. If my kid couldn't find a shoe in the morning and I was late to work, you know, I couldn't find a shoe. If you're working in a certain kind of context and your kid does that, and I don't know that there's anybody here whose kid hasn't done that, you lose a job. So I think working with the supervisors and creating a family-friendly culture, making it safe, making it okay, is step number one. And step number two is getting the information.
I'm Nathan Jensen, a City Club member. I have seen some research results from different sources saying that child's exposure to music, and specifically classical music, makes a difference in development in in the early ages. And I've even seen a report by a governor, I believe, of Georgia.
You have indeed.
Yes.
Sending them to all new parents.
Yes.
Mozart tape.
What is your opinion on that? What is your take on that?
I think that is no pass for social policy. I think it's trivial and ridiculous.
Okay.
I mean, that's what I think. I'm glad you asked that. Another state was considering sending Beethoven, so we could really get into some kind of a... Yes, of course I can elaborate. The brain research indicates that what counts is a relationship with a live human being, not a relationship with a tape. There's no question that sensory stimulation is important. But I remember, we have these silly fads. I remember when my kids were little, everybody was saying the mobile has to be black and white. It's bad to have colors for kids. I think it simplifies. We try to find quick fixes and quick answers. It's the same thing as if you put a kid in Head Start, you're going to inoculate them for life. No experience works like that. Raising a child is much more complex than that.
Hello, Jane. My name is Bill Parrish. I'm a City Club member, and I don't have any children myself, but one of the things that really strikes me with respect to younger parents is a lot of them, they just don't have time to spend with their kids. And my question is this. 2 weeks ago, the Willamette Week did a really nice cover story. It was titled Reading, Writing, and Riddlin', and it was published by Nigel Quiss. And then this last week, they did a story called Window Dressing. And the subject of the window dressing story was the notion, this theory I have, that there's a financial pyramid, basically, that's driving parents and all these organizations to work harder and harder to keep up. And they just don't have time to spend with their kids. Kind of a destructive socioeconomic thing that's not good for kids and not good for the economy in general. Do you have any thoughts on that? The notion of if you're a young parent in your 20s, two young parents, working really hard, both perhaps for a technology company like Microsoft is the subject of this article, and not having time to spend with your kids, and instead using surrogates for your children.
Well, if behind that question is the sense that, one of the parents ought to stay home and care for the kid, I don't necessarily agree with that. I probably would have abused my children if I had done that. If the question is there sufficient respect for the challenge of balancing work and family life, then I think that's a very significant issue, and some of the high-powered corporations are making it very, very difficult for young professionals and putting a lot of strain on kids. And we are seeing the consequences for example, in New York City, in the private schools in New York, where young children are really neglected. It's the phenomenon with adolescents where you give them a credit card as opposed to something else. So I think it's a real issue, and it's a real battle, even when you want to spend time with your children to do so. And that's why I think we need employer-friendly workplaces, and everything that drives against that is bad.
David Wu, frequently a City Club member, and Peter Heuser has been generously encouraging of me asking a question. First time it's ever happened to me in this environment. But I'm the member of Congress who represents this area. I serve.
Terrific. Have we got a task for you?
Yes, ma'am. Yes, ma'am. And in fact, I serve on the Education Committee and the Early Childhood Subcommittee. So I'll be all ears. Please pass on whatever you'd like to. But I'd like to ask a question based more on my personal life rather than what I'm doing professionally right now. I have a 19-month-old. A friend I'm sitting with over here has a child who's almost 3. So he's really feeling the pressure, and I'm feeling, some of the pressure of getting
ready to feel it.
Yep, getting that work done in the first 3 years. And the balance, it's the balance question. It's the balance question between raising a child who pushes the envelope, who has the creativity, and who has a chance of becoming a scientist, an artist, whatever, and the other side of the equation, not discipline in the traditional sense, but the internal discipline to be able to achieve. Striking that balance. I think every parent struggles with that. Because you want to encourage your child, and then when they become really active, you think, oh my gosh, you know, they're not going to have that internal discipline for the
Yes,
future.
some of us have been there. You train them to ask why, and then they do. You know, I think there's a danger of over-interpreting this brain stuff too. This is not pouring stimulation into a child. This is a child knowing that you can read the child's cues. And sometimes a child will say, enough, I don't want to do anything more. I don't want any more stimulation. I don't want to be smart. I don't want to do anything. I want to go by myself. You know, even little ones say that. And so it's really a question of learning how to read babies and little ones. And a psychologist wrote a book about the more affluent children called The Hurried Child. You know, the child who has music lessons and dance lessons and so that they can turn into some Renaissance college dropout, you know, because they say, give me a break, you know. So I think that it's a real balance, and that the real area, I mean, you know, the truth is that most of us have been raising kids who more or less do okay. We have rough spots, some of them don't do okay, but, you know, it's parents who themselves have not been well parented that I think who cannot give very much. I think I'm going to tell a story for the third time to capture this. This is a story about a Head Start program in Staten Island, which anybody who knows New York knows has no poverty, but there's a Head Start program there anyhow. And the staff were very concerned because the parents were not able to become engaged in the program. This was before they were asked to work, so of course they couldn't become engaged in the program. And there were many, many depressed parents, and the staff was very angry at them, which happens very often, actually, when, you know, when parents don't do what staff think that they should, they get angry at them, even though that's not the Head Start model and it's not what any of us want. So they decided, in a certain sense, the staff decided with a lot of help, they had met the enemy, and it was us, you know, and they decided they were going to change the way they related to the moms. Not telling them, what's the matter with you that you didn't get your kid to Head Start, but saying, what could I do that would help you? Not how terrible your kid is. And they paired this most skeptical staff member, this really is a true story, with skeptical staff member with the most difficult mom. And the staff member said to the mom, what can I do that would help you? And the mom said, I'd like a lottery ticket. Okay. And the staff member really gritted her teeth and bought a lottery ticket. And the mother burst into tears, and she said, nobody has ever bought me anything before. And they were able to make a connection, a relationship that transformed, eventually, the way that mother related to her child. And that's really the story of Head Start. It's the story of, at its best, it's the story of all the early childhood relationship-driven programs. And the important thing is not to mistake that for, quote, parent education. So that's a long-winded answer, but I think that I don't know what to do about your 19-month-old turning into a 3-year-old, except I hope you don't mind sleep deprivation.
Well, I think instead of going back to the office, I'll go home and spend a couple hours with him, so.
Well, that's a nice segue to my question. Thane Tansen, City Club member. I could not help but believe that there is a real need for parental education. A lot of parents probably recognize the deficit and consciously seek out that training and help, but a lot of parents don't, particularly young parents, uneducated people. What can we do we don't license parents, maybe some would argue we should, but are there ways that we can get that parental training maybe into the curriculum in high schools, maybe condition the receipt of publicly funded prenatal care upon mandatory parental training or something like that? But surely you've given this subject, it's a fairly important one, it would seem to me, some thought. I'd be curious about your thoughts.
I think it depends how you define parent education, and I think that's what I'm really trying to say, that some parents can take education in the sense that you probably mean it and I know it, you know. You hear something, you learn it, you think about it, you take it in, okay? Now, many parents can do that, and there are wonderful parent training programs. We find that for many parents, and I have to say that this is true in some ways probably for all parents. That's limited effectiveness. One of the things that we find is most helpful is parents talking with other parents with a facilitator and problem solving. How did you handle this situation? What did you do in this situation? And we have seen, for example, Head Start programs that use that kind of parent training in comparison with parent training that says, here's a curriculum on, 10 lessons to being a better parent. It really has more sustained power. And the kinds of things that I was talking about, relationship building in families, for example, where there may be domestic violence or substance abuse or something, has to even go deeper than that. But I think a sense of parenting is a very isolating thing. Where's the congressman, right? I mean, you're making decisions constantly, and there's nobody to tell you whether they're right or wrong, and basically you're not going to know whether they're right or wrong until the kid is, too old for it to make a difference. And that's always in the back of your head. So sharing this experience with other parents seems to be very powerful. One of the things that we're learning from some special early childhood mental health programs that are targeted to the most high-risk families are that it works best if there is there's parent-to-parent peer support. For example, parents in recovery as part of the staff. And that's very powerful for parents who themselves are struggling with substance abuse or domestic violence, as long as there is clinical backup, as long as there is somebody with mental health clinical expertise who can help and supervise, etc. So I wish it were a simple answer. I think your notion about high school education is wonderful. I think that baby alive kind of thing for teen parents is absolutely spectacular. We ought to have all teens, working in early childhood centers, supervised and learning how to care for babies and learning what it really means to have a baby. And one of the things that we haven't actually talked about is the role of young fathers in this whole effort. And I think there's a whole new recognition that if you want fathers to pay child support, then let them be involved and help them be involved in nurturing their children. And we have data that shows that. Another long-winded answer. You're asking good questions. I have to,
Bob Wheel, City Club member. You've commented very movingly about the role of the family, but family doesn't always exist. Would you comment a little bit about the role of foster parents?
That's a good question. Of course, increasingly many foster parents are family. They're kinship foster parents. Foster parents can play a wonderful role. In fact, if you've read Ghosts from the Nursery, it was in fact the foster parents who were the ray of light for one of the brothers in that family. We know something from developmental research, which is that even children, first of all, there are resilient children who come from the most horrendous kinds of multiple risk factors, and they're terrific and they survive and they do well. And we're learning that one of the things that they have is a caring relationship with someone. It doesn't matter. It doesn't have to be a parent, a teacher, a foster parent, somebody who has been there for them, can actually be what we call in jargon a protective factor. And I would like to see us try to build those kinds of relationships into our programs and make people think about the role that they're actually playing in a child's life. So I think foster parents are vitally important, and that we often don't give them the support that they need.
Hi, Gary Blackmer, City Club member and another father with a child rearing question.
You
got quite a string up here. My question has to do with some of the research that's come out about peers and their impact on learning. That it seems to be focusing more on the later years, but also it seems like we've had smaller family sizes. And I wonder what your reflections are on the fact that there's fewer siblings that are kind of playing a role in helping kids learn as they grow up. And secondly, what other peers and their impact might have on all this.
I don't really know the research on peers, so if you want an educated response, I can't give it to you. I'm an only child. I also can't give it to you that way. I think the issue of social competence in children is very, very important. It's visible early. I think it's one of the cues that young children are in trouble if they can't play well with other children, and that we need to pay attention to that as a diagnostic clue about how well children are going to be doing. And you may be referring to collaborative learning and all that sort of, are you, in your question about peers? Okay. You know, as a social scientist, I have to say that I think some of these kind of either-or things are a little silly. I think it's a stage-related thing. Obviously, adolescents are very much influenced by peers. Younger children are more influenced by parents, but I think it's that psychologist. I know who you mean, and I think my friends who are more critically aware of the literature tell me it's a misreading of the literature.
B.J. Seymour, City Club member. I'm curious as to what kinds of behaviors get a kid thrown out of preschool, and what would be the appropriate remedial measures to take for these kids?
Throwing a chair at another child. You know, part of the answer to that question really depends upon the skill of the staff. Okay? That's really the answer. If it is a skilled director who sees that the child is anxious. Actually, let me give you an example. I'll make this really concrete. This is a child called Jasmine. I talked about Jasmine yesterday. Jasmine looked like she was not only headed for getting expelled from Head Start, but also being placed in foster care. She was a teacher's dream. She would stand on tables, run out in the hall, defecate in the hall, swear. This was a 4-year-old, okay? That sounds pretty serious, right? You would think she's headed for trouble. In this particular Head Start program, they had an early intervention team. They tried some behavioral management stuff in the classroom, and frankly, it didn't help, and they decided they needed to really engage the family. They tried to do that, and the first thing the mom said was, "I don't know what's the matter with you. There's nothing wrong with my child," which, if any of you are mental health people, you have probably heard. They had a wonderful child psychiatrist there who went out to the family, asked the same question I told you about in Staten Island, only this was in Stark County, Ohio. He said to the mother, "What can I do that would help you? Not, you know, this is a really rotten kid and you're really in trouble, and if you don't shape up and I'm going to give you parent education, what can I do that would help you?" And this is what she said. She said, "I have a new baby, I have a job, and I'm in school. I would like to be able to do my homework." And you know what they did? They brought a respite care worker in using flexible mental health dollars to give the mom some relief so she could do her homework, relieve the pressure on her so she could relate differently to her child. The child got some specialized coaching and attention and help, and they did some other things, and the child did not even enter into special education. Now, there are some people who say, "What, you use mental health dollars for somebody to help with homework at dinner time? I would like help with homework at dinner time too." But it was pursuant to a clinical treatment plan, and it didn't last forever. It lasted until the mom was able to really take over and do some learning. So in another circumstance, that child would have been expelled. So it's very much environment and support system dependent, but we are seeing children, I didn't really believe this for a long time, we are really seeing more and more children who meet the criteria of serious emotional disturbance who are younger and younger. We have a real problem with most mental health systems, not yours, that don't recognize any kind of emotional and behavioral problems before the age of 6. Totally out of sync with our knowledge about attachment, infant-child, infant-parent attachment disorders, etc.
Thank you for coming and talk to us, Dr. Knitzer. I want to say we appreciate she hung around an extra day today, and she's got to get the red eye back tonight, so we appreciate that sacrifice for visiting with us.
Why. Both my daughters are home, one last week, one this week for spring vacation, so I can be a good mom.
Good. Well, I want to say for the record that I did encourage David Wu to ask a question even though his membership lapsed, but I let him do it with the understanding that he was going to renew that on the way out today. So let's watch him to make sure he doesn't slip by. So we'll see you next week. Remember Maria Eitel, who's going to talk to us about Nike's perspective on the manufacturing situation in Asia. Thank you for coming.